The nursing process is a systematic, evidence-based approach to patient care. The nursing process is a dynamic framework that guides nurses in providing effective, patient-centered care. The nursing process consists of 5 steps: assessment, analysis, planning, implementation, and evaluation. Originally developed in the 1950s, the nursing process has been continuously updated to reflect best practices. The process is systematic, flexible, patient-centered, evidence-based, and goal-oriented. The first step is assessment, where comprehensive subjective and objective data are gathered to establish a baseline for care. Assessment data can be subjective, such as the patient's experiences and feelings, or objective, like measurable clinical findings. For example, a patient may report dizziness, which is subjective data, while their blood pressure and heart rate are objective data. In the analysis step, assessment data is interpreted to identify patient needs and prioritize care. Critical thinking and frameworks like Tanner's model or the NCSBN clinical judgment model are used for clinical judgment and prioritization. For instance, a patient with low blood pressure and tachycardia may indicate hypovolemia or dehydration. The planning step involves setting SMART goals and designing individualized care strategies. Nursing interventions can be independent, dependent, or collaborative. An example goal might be for the patient to maintain systolic blood pressure above 100 mm of mercury within 24 hours with adequate hydration. During implementation, planned interventions are executed and patient responses are continuously monitored. For example, administering IV fluids is prescribed and reassessing blood pressure and hydration status every hour. In the evaluation step, patient progress is assessed to determine if interventions were effective. If blood pressure remains low despite fluid resuscitation, the diagnosis should be reassessed and the care plan modified. The nursing process can be applied to various conditions, such as heart failure, by following the steps of assessment, analysis, planning, implementation, and evaluation. Common pitfalls include misinterpreting assessment data, failing to prioritize effectively, and lack of clear documentation. Enhancing patient safety, improving decision-making, and providing a standardized approach to care are key reasons why the nursing process is essential. Incorporating the latest research and clinical guidelines into the nursing process is crucial for evidence-based practice. Electronic health records, clinical decision support systems, and AI-assisted diagnostics play a significant role in modern nursing practice. The nursing process remains a fundamental approach, ensuring comprehensive, effective, and patient-centered care. Our sources include the ANA, NCSBN, the latest nursing textbooks, and evidence-based guidelines.